I've been dealing with it for 21 years, it's okay. So I'm walking down this dark corridor of the airport in Birmingham, Alabama at night, and there's really nobody around. And I see off in the distance that somebody's coming toward me, and we're the only two people in the hallway. As we get closer, I can see that he is a white male, appears to be about the same age as I am. And when humans interact with each other that don't know each other, we do several things. I'm going to make explicit what you already know. We look at the person's face, and the part of our brain that recognizes faces is activated, and we determine, is this somebody I know? Once we determine it's not, we say, okay, what can I find about this person that makes them similar to me or different from me? And then we determine, how do I respond to this person? Do I smile and say hello? Do I put my head down and pretend I don't see this person, right? What do I do, right? I mean, this is, you may not want to admit it, but that's what you do. Put our head down. So we start getting closer and closer to each other, and I can tell our brains are both doing the same thing. You're trying to figure out, okay, what do I do? How do I react? Do I say hello? Do I not say hello? Do I just be a human and acknowledge the presence of another human being or not? But as we start getting closer to each other, I notice that he's wearing a blue t-shirt with a block M in yellow. You would call it yellow, but we, University of Michigan graduates, call it maize, by the way. I'm wearing a t-shirt that says Michigan alumni on it. And as we get closer to each other, we notice that we are a part of the same cultural group. Suffering University of Michigan football fans who in my case happen to live in Penn State territory and have to deal with that. So what happened is we wound up stopping. We spent probably 20 minutes in that corridor just commiserating about that new football coach and how much he has destroyed our story. So two people, members of the same cultural group, had a great time because we were able to activate and identify the fact that we had that commonality. So I was talking to an executive from a large healthcare organization who tells me that he works at the system level, but he occasionally visits the system's hospitals and just kind of walks around to see what's going on, comes in unannounced. And he said he was in one of his hospitals one day and saw a nurse go into the room. So he kind of hung around outside the door to listen in on that interaction to see what happened. And he said that the nurse conducted herself exactly the way we would have all expected and wanted. She was professional, she was respectful, she was appropriate. She talked to the patient, asked the patient how she was feeling today, what were her symptoms. The patient says, oh, I'm doing okay, it's no problem, everything's fine. The nurse finished and she left. The housekeeping staff, someone from environmental health sciences, came into the room. This was a black woman, by the way, I didn't mention that. The patient was an African-American woman, the nurse was a white woman, the housekeeping staff was an African-American woman. She comes into the room next and says to the patient, so how are you feeling today? Oh girl, my feet are hurting, and I don't know, I can't seem to keep anything down, I'm hungry, but I don't know, I'm just not having a good day today. So the woman leaves the room, and the executive says to the housekeeping staff, what are you going to do with that information? What do you mean, what am I going to do? You just found out some information that could be really important. Are you going to pass that on to the nurses or the doctors or somebody? And the housekeeping staff says, they'll never listen to me. And she's right? So the point is, this important information does not get passed into the system, right? So now, he then goes into the room and says to the woman, walks in the room and says, this is the day the Lord has made. And she responds, and let us rejoice and be glad in it, right? Which is, for non-Christians in the room, an interaction that any Christian would have recognized. Then she says to this executive, you're my brother, aren't you? And he says, yes, and he's a white male, by the way. And then they start talking about Christianity. And then he segues the conversation into talking about how's she feeling today. Oh, I'll tell you, my feet hurt, and I just can't seem to keep anything down, and I can't, I'm not having a good day today. And then he passes that information on, of course, to the physicians. The point being, first of all, quality care is everyone's responsibility if you're working in a healthcare organization. Everybody. The first person that most patients encounter when they get to a hospital is the parking attendant. And the parking attendant needs to be trained in cultural competency, because if the parking attendant doesn't recognize that part of their job is to provide quality health care, the parking attendant can begin their patient's experience on a negative footing. There was one executive, and because these are good stories, I'll even tell you who. There was one executive, she was the CEO at Denver Health. When she came in, the first thing she did was to rewrite everyone's job description and add to the beginning of it to provide quality patient care, and to work as a security guard, to provide quality patient care, and to dispense food in the cafeteria, to provide. Every single person is responsible for patient care. I mean, when I'm in the parking garage at Hopkins and I see a patient who's lost, I feel it's my responsibility to say, where are you trying to go? Are you lost? Can I help you to get somewhere? Because if we want patients to have good outcomes, patients have to have good interactions with us when we're in these settings. So I want to end on one last story that I think is illustrative of how we can make change within the healthcare system to produce better, good outcomes. And this was a hospital in Pennsylvania, right outside of Philadelphia, Pennsylvania. They needed to hire a new chief of medicine. And they were so excited that they had an interview with this physician who was coming in, very well-respected physician. And female physician was particularly important for them because they were really trying to increase diversity in that area. So she comes into town. They send a security guard to pick her up at the airport. Security guard picks her up, drives her to the hospital. She spends the day there. They do their interviews. The day ends. The security guard takes her back to the airport. And the first thing the CEO does is say to the security guard, come into my office. And the first question he asks is, how did she treat you? Did she talk to you? Did she engage with you? Did she treat you well, or did she treat you like some sort of unimportant underling? And the security guard says, well, she didn't really talk to me very much. She just treated me like somebody who was just there to drive me to her appointment. And the CEO decided at that moment that she was not the right person for them. She was not going to fit into their culture. She was not going to fit into their organization because she may have been a great diagnostician. She did not have the interpersonal skills to fit into an environment where the provision of patient care was important for everyone, including the security guards. So I can assure you I had a wonderful PowerPoint that would have just wowed you. And you'd be standing in the aisles now applauding, but thank you for your time and attention, and I'm going to end there. And
I'm going to ask the last question so we can stay on task here. If everyone gets my mind, this question is for Dr. LaVeist. We have an esteemed group in front of us that care about asthma disparities, and you know a great deal about disparities in healthcare. So if you were going to capsulize what they can take back in terms of elevated consciousness into their workplaces, so that they can at least carry in their minds and in their hearts that disparities exist and we need to be sensitive to them, what would your message be?
That is some question. Put me up. Yeah, well, I think what I would say is that, what we try to do is compartmentalize knowledge into these categories, disciplines. this is biology and this is anthropology and this is botany and so on and so forth. But the physical world doesn't conform to those boundaries. I mean, the fact is that to really understand a disease and to really be able to treat a disease like this, you really need to go across disciplines. And I think that the program we just heard about in Children's Hospital is a perfect example of going beyond the traditional bounds of medicine and going into, sort of taking into consideration aspects of social work, understanding the community, understanding the patient outside of the context of the healthcare system and how best to reach that patient. And I think that that's what Disparities is really all about. Disparities are really produced by multiple levels of the society, the broader social environment, individual level behavior, the healthcare system. It's all of these things combined. And as we think about solutions, what I would suggest is that as you go back to your places of work, that you think about how you can incorporate all of that into your solutions and not view it as something that is to be dealt with only when they come into the healthcare system, but also when they leave, and how you can get as much of that healthcare outside of the walls of the hospital and into the community.